My name's Reda Sadki. I'm the president of the Geneva Learning Foundation, and this is my presentation on modern approaches to learning and training. It was requested by the 15th meeting of the WHO Radiation Emergency Medical Preparedness and Assistance Network. This presentation was first made in Geneva on the 5th of July 2017 at WHO. Now, this should be a familiar learning architecture to most of us. This is a training workshop, and the physical configuration of the room suggests a number of things about how learning is organized or intended to happen in this kind of space, in this kind of learning architecture. And here we have a transmissive model in which there is presumably someone from whose point of view we are seeing the members of a training workshop who is going to share information that will then be received by the participants, and they will presumably gain knowledge and perhaps be able to use and apply this knowledge to their work. Now, this configuration has been amazingly resistant to change for many decades in public health. It remains the prevailing dominant paradigm for how we learn, but we believe that there are a number of significant changes in the nature of knowledge, in the nature of society, and in particular the digital transformation of how we learn, how we work, how we get things done, that call for new approaches, and this is what I want to focus on in the presentation. So first of all, if you were a knowledge worker in 1986, 75% of what you needed to know to get your job done was right there in your brain. By 2006, that percentage had fallen to 10%. So in 2006, if you were a knowledge worker, 90% of what you needed to know in order to get your job done, you got by connecting with other people, and increasingly in the last decade, with machines. So that's a very profound change. And the question to ask is, does that learning architecture with the transmissive model actually work when, in fact, what you need to know, you're not likely to acquire in a transmissive setting. You're likely to need at the point of work. And so what kind of learning approach, what kind of pedagogy is actually going to support the skills and the behaviors and the competencies that you need in that kind of environment? Second, when knowledge, everything, it seems to keep getting faster. It starts with our inboxes in our email clients. There's so much stuff. There's an abundance, many would consider an overabundance of knowledge. And we keep trying to think of knowledge as a reservoir. We keep thinking of knowledge as a product. And the transmissive learning approach, the workshop training model, actually repeats and replicates that assumption that really it's about transmitting enough information to people who are its recipients so that they are then able to use it. But what kind of learning approach would we need if we were really to sort of take on board the fact that increasingly knowledge is a process? So basically, our takeaway is that the existing means we have of doing training, learning, education, capacity building for global health do not meet the requirements of the changes that we have experienced and of the ongoing changes, many of them linked to the digital transformation, but also to many other changes that are fairly profound and deeply affecting and impacting the nature of our work, how we do our work, and how we deliver results. So we need to do new things in new ways. Now, there is an old bugbear in which in the past educators opposed and compared and contrasted face-to-face training to online training, and that question which was better, which medium was better than the other, in what context. In 2010, the largest ever meta-analysis looking at this question concluded that actually since the early 1990s, people who learn in distance learning programs actually have slightly better academic performance than those enrolled in traditional face-to-face programs. And that's been true since the 1990s, when the technology to support learning was far more rudimentary than it is now. So we consider that question to be settled, and it's really thinking about context and then looking at what medium or media, if it's blended learning, are actually going to be most effective in a particular context. But many of the outcomes that we in the past thought required face-to-face, shared physical space and sort of intense workshop type activities, or other kinds of activities, we now realize can actually be achieved online on a scale and in ways that are simply unimaginable and inachievable by other means. And to provide an example, because we're talking because of the topic of the meeting, selected a quote from a learner who is a pre-hospital emergency worker, who says, "The course primarily created a deeper sense of risk awareness, whereas the main thought process before each call was medical revision of the task at hand. I now also think of the possible risks and best practices in each situation." And this is very significant from a learning perspective, because this demonstrates a change on the highest order level of thinking in terms of mindfulness, in terms of reflection and analysis that's implicit in this statement. And that's quite a profound change to achieve in this case, what amounted to 16 hours of learning time in a particular pedagogical model. And in fact, because I only have 10 minutes, the pedagogical model I'm going to present will be singular. There are many others, but we believe this one is actually particularly relevant and tightly aligned to the needs of many global health, learning, and capacity building contexts. So the Scholar Partnership is the conjunction of the University of Illinois College of Education, the Geneva Learning Foundation, and Learning Strategies International. These three organizations came together in order to support the work of other organizations, some of which you see in this screen, in order to encourage and support them in adopting what we call the Scholar approach, which in a number of ways maximizes the affordances, literally what you can afford to do with digital learning, and shares the specific kinds of tangible benefits and processes that can help in the context that these organizations work in, and the challenges and dilemmas that they face to build capacity, support performance improvement and results on the ground. To take an example of a course we ran last year at the World Health Organization, this was about the WHO's new guideline on routine immunization and specifically transformative investment. What you see on the left is not the guideline, it's actually the student project that they developed during the course. And basically, for the cost of a small workshop in Geneva, we were able to convene 800 applicants from 70 different countries. And in 6 weeks, a first cohort produced 50 country-specific activity plans tightly aligned to the global guideline from the World Health Organization. And over 90% of respondents in the follow-up survey reported that they would actually be putting this coursework to use in their annual immunization planning. So we covered and resolved a number of dilemmas that typically undermine the effectiveness of training and capacity building initiatives. We achieved scale, we achieved relevance, we achieved applicability. People produced knowledge and learned to use the guideline by applying it in their own context of work and reconciling the global standard intended to be universal with the specificities of their own context. And we believe we can take this approach, and we have with a number of these organizations that in a very flexible way can support the effective implementation, going from being a think tank of producing a guideline to being a think and do tank, in which the organization at a marginal cost compared to the initial cost of developing the guideline can achieve applicability and transfer, and achieve also double loop learning, in which the participants will also feed back on the relevance and usefulness of the knowledge produced at the global level. Now, this Scholar approach can be compared to at least two other approaches. One is face-to-face, and the other is transmissive learning, such as massive open online courses known as MOOCs, or courses that use Moodle to deliver content. So we can compare development costs. We can compare the cost of delivery. We can compare the learning efficacy, and we can ask whether or not this, each approach scales up. And as you can see, we believe that the Scholar approach has a number of distinct advantages and benefits over the other prevailing approaches. Now, these are just some of the criteria. Here are some more. If we look at scalability, in a Scholar course, there is no upper limit to the number of participants. The cost per completers is higher, slightly higher than a MOOC, but far significantly lower than a Moodle-based course. Completion rates are significantly higher than MOOCs and Moodle-based courses, which are tutor-led and do not scale nearly as well as Scholar, in which we use peer review to achieve scale and provide formative feedback. The expert time required, typically there's a lot of front-loaded work in the other approaches. In the Scholar approach, we minimize the amount of expert time needed. I could go on with the rest of this list, but the bottom line is that on each criterion that matters for effective learning and capacity building, we have zeroed in on the Scholar approach, and we've developed it to address a lot of the challenges faced by learning, education, training, and capacity developments for global health work. Now, this is why we believe that this Scholar approach is amazingly versatile and has application and relevance, whether you're trying to do capacity building, training, if you have a strategy that you wish to implement across a global distributed network, if you want to accelerate the development of leadership, if you need to develop and document situations and case studies on the ground rapidly, if you have to actually implement guidelines and do action planning. All of these are examples of applications where we have already successfully used the Scholar approach to support and deliver results for organizations with these objectives. So really the question is, if your organization is facing a complex challenge, so that could be a capacity building challenge, but could also be about leadership, about strategy, execution, or learning and training. If you have an interest and a need to scale, if currently you have more people to train or prepare or support than you have resources for, this is an amazing approach that can scale at far lower cost than other approaches. And it can also empower local communities, recognizing the relevance of indigenous knowledge and connect them to global networks. And finally, if your organization realizes that the conventional approaches that you've tried are not delivering or have not delivered the outcomes that are needed, then that signals potentially an openness to try a new and different approach, which has already been tested and proven by others, and where we today have a lot of know-how and experience with figuring out how to adapt the Scholar approach to a particular context of work. So this is why I would like to invite the members and participants of the meeting to consider looking at the Geneva Learning Foundation's call for proposals. And we've just published the request for expressions of interest. So if after viewing this presentation you would like to know more, and if you have one of these challenges around capacity building and training and scale and efficacy and applicability, do consider completing the expression of interest and submitting an EOI. We are very eagerly looking for complex challenges. We're looking for the wicked problems that we can zero in on and apply the multiple lenses that we use in order to unpack the problem, develop an appropriate solution using or based on the Scholar approach, and work in partnership with other organizations to actually progress against these challenges that we face. Thank you for listening, and if you would like to know more, of course, I very much encourage you to consult the Geneva Learning Foundation's website. Thank you.